first order of business is to review the minutes and we look for a motion of acceptance.
Did you get a chance to look at them already? Okay. Yeah, I took a look at them too, so make a motion.
I second that motion.
All those in favor?
Aye.
Right. You know how easy it is, huh? Do you want to wait on the tattoo regulations, do the Board of Health fees first, or?
Well, we want April for Board of Health fees, but I think we can do the tattoo regulations. And I'm sorry, tell me your name again?
Joel Marmolejo.
Joel. So you are opening a new tattoo studio, correct? And you're looking for a variance because your studio doesn't have walls in between each section, correct?
Yes.
Yep. So this is a good preview of what's to come in 2025. Right now, our body establishment regulations state that each room that you can receive body art in needs to have floor to ceiling, basically walls. They need to be rooms.
Privacy, yeah.
Yeah. The Public Health Collaborative that Lynn participates in is working to update the regulations similar to the new National Environmental Health Association regulations. So if, for instance, you've ever gone to the Boston Tattoo Convention, I don't know if you've ever been, they do it at the convention center, and it's completely wide open. There's no walls, there's nothing. They've learned over the years since the original body art regulations were put in place that you don't really need that much separation. So he is asking for a variance from our regulations to allow his establishment to be open without those walls in there. That's what he's looking for. That is going to be something that we're going to recommend in updated regulations. So it is a technicality right now, and I just thought we should handle it the appropriate way.
So the only reason you really would need privacy was if tattoos were being done in an area which shouldn't be publicly watching through the window.
Right, and there is a requirement that if someone wants privacy, there's a curtain or something, or
Yeah,
you can
I
bring
have
them
a
in.
kind of fake wall that you can make your own room, and
Right.
like you finish the section, another artist can use it, and I have two of them. So
Yeah,
we don't use that much, honestly.
Yes.
When people get tattoos, like always, we need to see only one area of the skin, and we cover it with clothes and anything.
So was the old regulation like a misunderstanding of the infectious disease risk? Like,
the old regulation is based on a model regulation given to the state in the early 90s. The
We're just
state wasn't
progressing.
even willing to come up with a state sanitary code for body art at the time,
And
right?
nobody knew what they needed because nobody did it.
And, now it's much more common. I mean, they're popping up everywhere. And like I said, actually prior to COVID, you guys may remember, you guys may not have been on the board at the time, but we had started working on changing the regs. And we had working groups with the body art establishments and different practitioners about what are the best practices now. Like, our regulations still talk about autoclave. I bet you use everything disposable, right?
Yeah.
Right. So no one even autoclaves anymore.
People get scared if you don't use anything.
Right. So I mean, our regulations talk about
We're
that stuff.
antiquated. We're antiquated.
So yeah.
Excuse me, for the privacy, I have something like this.
Okay, great. Yep.
You know,
Yep.
so I have
It's like
two of them.
Yep.
Like a cute little
Okay.
Yeah.
quote.
You know,
So if the client
And this is for the
requests
shop.
privacy, you can give it to them.
this is the shop.
Yep.
And let's just say we
So
get
I
a
have the
crazy,
space for now.
Yep.
let's just say we get a crazy client that doesn't want privacy and it's not a place to be having a tattoo for the public to watch, then the proprietor has to be the responsible party, say, wait, you gotta have you know what I'm saying? I mean, we don't want shows downtown in the front window with little kids watching, you know what I'm saying? Well, it can happen.
Yes.
I mean, if we don't have a regulation, or if we don't take that into consideration,
Yeah.
then you're gonna be back here saying, why did that happen? You should have known. We've been there, done that with the city.
I also have another room especially for that. If some lady feel uncomfortable, so
Yeah.
we take it to that room.
Yeah.
Yeah.
We door everything's closed.
Yeah.
But I wish everything come in front that people can see what we're doing, like to not be afraid.
Sure,
Yep.
sure.
Yeah.
Is there any, for us to vote on the variance, there's nothing with the building department that You know what I'm saying? Like, does he have to get it from us first to get something from them? I know there's been regulations like
The
that.
building department will go in and do like their certificate of occupancy inspection, life safety. and
Yeah, I got already. They
Which is
went over there
totally
already.
different than the
fire-
requirements that we have, yeah.
And the building inspector, they went, I just waited for you guys, give me the good to go.
I just only asked because I saw the floor plan, so I didn't know how technical we were getting,
Yeah.
and I wasn't, I didn't remember what the tattoo
Yeah.
regulations say.
And Clark, like you said, it was really more about infectious disease control, having that in case there were splatters and stuff like that, and it just,
like
right.
antiquated.
It's not really, it's
But
not
there-
really the case that we found out.
But there are high-level sanitation and all that stuff associated in the regs too, you know.
Oh, absolutely.
There's a lot of
Oh,
things they gotta do that we
absolutely.
never knew
Yep.
about. You know, to be safe, to get away from the going Joe's basement and have it done for 20
Exactly.
bucks, you know, unsafe practices.
Exactly.
So that was all spoken of when we did, we had nothing, and it was happening, and the
Right.
state was gonna allow people to tattoo, so we had nothing, remember
Right.
remember Phelan came down, oh, you weren't
I-
here when
I
Phelan came
wasn't
down?
there,
saying
but
that-
I remember
that
it.
He didn't even want us to have a regulation, we don't want those people on us, he said, what are you, crazy, we can't not do.
Yeah.
It's the law, you
Yeah,
know?
yeah, so our current regulations in Lynn go back to that regulation. And post-COVID, when I went to pick the tattoo regulations back up again and realized that the collaborative was working on a set of regulations that really encompassed what tattooing, body art, microblading, permanent makeup, it's, has turned into, along with the schools that are opening to teach people how to microblade. These regs are gonna encompass that as well, like what do you need to be an instructor so someone can learn how to do that stuff, and it's gonna cover having apprentices and what does an apprentice have to do, and so it's a really comprehensive set of regulations that the collaborative is working on. So that will be coming to you in 2025, but in the meantime, we thought it was the right thing to do that, to let him, to go forward and to, grant the variance for him, but,
So the proposal is to request a variance to allow for movable partitions that aren't floor to ceiling?
Correct.
Okay,
Yeah.
yeah, I make that motion.
And, well, before we have the motion, so your recommendation is that we do, because I always gotta blame somebody, I'm not blaming me. Your recommendation is that the variance is allowable and that we should give it to him, correct?
yes, correct.
I just wanna make sure. Okay, so let's, on
Yeah, I make the motion, yeah.
Yep, second the motion we're looking
I
for?
second that motion.
Beautiful, all those in favor?
Aye.
Aye. Good luck.
luck.
Thank you very much.
Nice to meet you, good
Nice
luck,
to
we'll
meet
get
you.
something in writing to you.
Okay.
Okay, and
And
it's,
this is-
April's here too, and so she knows, but we'll get something in writing to you.
And this
Alright.
is the tattoo shop across from Lupita's, right?
What is it?
Is a tattoo,
Lupita's.
the tattoo shop across from Lupita's Tacos? On Main Street?
Lupitas?
Yeah. Is it-
This is
No,
on
no,
Western
it's
Ave.
right,
Western Ave, okay, why didn't I?
you
thought
know
it was
Juan
on-
Parrilla?
Yeah?
Yes, right.
Yeah,
on Western
across
Ave.
from the street.
Okay, is he still there?
Yes.
Okay, good.
Yeah,
I see the sign, but it was closed. I don't know
Okay.
what happened.
Interesting,
I
okay.
don't know why I thought it was on Main Street.
You might be thinking of, so you're Holy Inc.,
Yes.
but there's also Hood Inc.,
No,
Yeah.
that one, no.
Right,
No,
but-
I know what
It's
you're talking about.
holding.
but Hood
There's
Inc.
another
also
one
has
across
one
the
on
street.
Monroe Street, which is by Lupita.
Right, it's
There
right
are
on
two
the
shops
station.
right there.
But
Yeah.
there's one across the street from it now.
That's
Two.
not hoarding. That's
It's next to
another
the, next to
one.
the tribal agency. It's different.
Okay.
It just says tattoo on the top, but
Oh.
it doesn't say any.
Okay.
Never mind.
We used to have a
I'm
guy
all set.
selling
You're
cigarettes.
You're
all
all
set.
set. You're all set.
Thank you very much.
Good luck.
Thank you.
you.
Nice
Nice
to
to meet you. Happy
Have a good
holidays.
holiday, my friend.
Like I said, we'll get something in writing to you.
All right.
Thank
Good
you.
night.
See ya.
You too, bye.
April, are you here with us? April looks like she's on mute.
She is indeed.
Do we need to unmute April?
I can ask her to. but I like her to. Sure.
This is what we get for trying to be fancy and zoom her in.
I'm here.
Hello, we hear you.
I heard all that.
Okay, great. All right, lady, you are up to give a presentation on the new fees.
Fun. Okay. So in front of you, you guys have the new fees, across the board we're looking to increase. About a little over 5%, just kind of rounded them up, so we're, an awkward number. But everything is in accordance with, ISD kind of one by one and looked at them individually into what the cost is with the current contract that we have for food inspections and things of that nature.
So there were go ahead, April, are you still going?
Sorry. And to know that some fees haven't been increased in many years.
So, yeah, I think the last time we increased some of these fees was 2020, correct?
Correct.
So I did want to discuss in particular the tobacco license fee. But as April said, 25% kind of across the board. In terms of the tobacco licenses, we did hear from Joyce at our last meeting, and we've heard before, that per capita, the city of Lynn has more tobacco licenses than surrounding communities. And she's very eager, as am I, as a public health action to lower the amount of tobacco licenses in the city. And we use that simple phrase of, you know, we don't want our kids walking past 10 stores to buy tobacco, whereas other kids walk past 3, right? There's a lot of communities going towards tobacco-free generation or nicotine-free generation, which is, you know, somewhat controversial. I do think that as a public health measure, increasing the fee by doubling it to $300 is a way to start letting retailers know that,
Too expensive to have tobacco
well,
license?
I mean, I do.
It's
It's, you know,
economics.
it should be a little bit of an ouch to sell a product that has such a harmful effect right now. I mean, like for instance, liquor licenses, they're not cheap. There's a reason they're not cheap, right? The surrounding communities, our public health collaborative, they will all be looking to double their tobacco fees as well. So even though the fee price may not be exactly the same, they will be doubling their fees at some point too. We just happen to be the first community that are raising our fees right now. I do think we see when people come to us and we issue them a fine, they are ready to pay that fine quickly. But they are begging to not be suspended, right? Because that's a huge loss. I don't see the double being something that would prevent anybody from getting a tobacco license. But I think it just starts to show that we're taking this public health threat more seriously. We're not looking toward nicotine-free generation like other communities are. And in that sense, you're still able to sell tobacco in Lynn, but there's a price for it, you know? And there may be an opportunity at some point with increased fees to do increased inspections and increased inspectors, you know, I mean, that's not a decision that I can just unilaterally make, but with increased fees, you know, we can do more things.
Well, we still have Joyce's program, right?
Yeah, and you know, that, I do not know where the funding for her program comes from the state. I do know that the state has notified public health departments that 50% of DPH's funding, or approximately 50%, comes from the federal government. So there may be a chance rather that DPH has to reprioritize where they're spending their money. I don't know where that will go. I don't know where tobacco control is gonna go as more communities do go to nicotine-free generation. And if it ever came to be that we needed to start doing our own inspection program, we would need fees that would cover doing those inspections, right? Like, our fees need to cover the administration of processing the license, you know, mailing out the renewal, printing the license, getting it out there. Joyce's program right now handles the inspections. That may not always be the case.
I know we spoke earlier, or April spoke about, you said that the fees were raised 25% across the board? Mm-hmm. Then I did some bad math here or something, because when I looked at every fee, took the original amount by a percentage to get to the new amount. I didn't get to 25 on everything. So I don't know if that's me.
Well, April, I know that you said when you did the 25%, if some of them came to like an odd amount, like, hey, 196.27, you just like rounded it up to 200, correct?
Correct. And then with exception would be the 6-month licenses and the full year licenses, because what happens.
April, I'm sorry, 1 second, there are people talking in the hallway, we're just having a hard time hearing you.
Sorry.
That's okay.
Okay, that should be
All
better.
right, go ahead now, try it again, girl.
So the numbers that are significantly increased over 25% is mostly on the 6-month range, because what we were finding is that to get a 6-month food permit was $100, but to get a full year permit was $300. So people were getting 2 6-month permits and saving $100. So we needed to make it half of whatever the full year annual permit was, because it's not making any sense. It's not adding up.
And we did, I know April looked into ensuring that the food fees covered our inspection costs, right? So every food fee is based on an inspection type, and an inspection type is based on the number of inspections that they need per year, per the FDA risk-based system. So the RB4s, risk-based 4s get 4 inspections, the 3s get 3, the 2s get 2. And the 1 gets 1.
Let's look at the simple one. Body art tattoo only apprentice. Originally 50, going to 75. That's a 50% increase, right? 50% of the original cost.
So April, Ronnie is talking about body art, and I don't think these body art fees incorporate the public health collaborative fees, correct?
Correct.
Okay, so these were the fees that you had come up with?
Remember you had asked me about that email and I couldn't find that email.
Okay, so these are just the fees that you had come up with. So Ronnie was questioning tattoo only apprentice, $50 going up to 75.
That's 50% of the original.
That's only
amount, right?
apprentice $50. And to add to that though, it is I think because it was an off number, and we don't even have any tattoo apprentices. No one ever files for any of those. We don't have any of them on the system.
We're going to in 2025 with our new regs.
Let me ask this. Would you object to me tabling this for 1 month to do some more mathematics on this list, and then we could talk about it next month?
No, not
I
at
know
all.
you said you were looking for a vote today, but look, I'm all for raising the fees. I think raising them all 25% or whatever percentage is the same is good. If we pick and choose to raise some higher, AE, you give us a reasoning. We need to pay for the inspector, or we haven't raised that one in 20 years, or whatever it may be. But there's a lot of stuff here that we're raising. I would like to just look at it again.
Yep.
Because, I mean, I only got it yesterday, because like an idiot, I didn't see the thing Friday, or it didn't show up on my email. But I would like to just look at these numbers, maybe do some other math again. Maybe I figured it wrong, and come back better prepared at the next meeting to, not the question, look, there's no question we need more fees. I wish the money came to us. It goes to the general fund. And, you know, if it's all right with the other members, I'd like to relinquish the chairmanship and make a motion to table it until next month to give us a chance to just look at the numbers a little bit more. It's nothing against that. I don't want to do it,
Yeah, no,
or
no,
I'm
no.
not in agreement.
I do just want to point out one thing, and April, correct me if I'm wrong, the rental program fees are not fees that the Board of Health is voting on, because that is through ordinance, correct?
Yeah.
Correct. So anything that is, so in the last column, I put who the deciding factor is, whether it's council, board of health, ISD.
So do you see that where it says?
So on. So it's only the
Yeah.
board of health ones that be involved in. This is just my handy dandy spreadsheet, so I
Yep.
have everything together, because it's
Yep.
everything that I do.
And I guess with looking at the food permits, I see the 6-month ones for the type 1 and type 2, the 6-month is 50%, or is half of the full year, but for 3 and 4, it's still cheaper to do 2 6-month ones.
Yes, that's a typo. I actually have the corrected one here.
Okay.
I might
sorry, guys.
have that on. Because it was actually the mayor who pointed that out to me, so.
I apologize, I thought this was the corrected one that you guys got.
Okay.
I do want to bring up one more thing while we are talking about it, and it's something to think about. And what April and I will do is get you a corrected update on this. As I was talking about the body art regulations, and also along with having regulations that are in every community, we wanted to make the same fees in every community. And Beverly right now is going to vote on their regulations and their fees. And once they've kind of gone through them, we're going to look to do the same thing. So you will see an increase that is higher than the 25% we're seeing across the board. But it's to make up for the time that we've put into these new regulations
Beautiful.
and the increased inspections that it will be for establishments, practitioners, apprentices, schools, and instructors. So there's going to be new categories that we will be implementing. As a matter of fact, Kitsio is, our public health nurse, is also going to be part of our body art inspections. She's going to be reviewing practitioner paperwork and certificates, making sure they have the right grade certificates for bloodborne pathogens, CPR, and all those different things that they need. There's another class they
Great.
need.
So that's just for body art?
That's just going to be for body art, yeah. So that will be more in line with the Public Health Collaborative.
So you're gonna email us a new chart, and I'm gonna relinquish the chair, make a motion to table this until the next meeting. Is that okay?
Yeah.
Okay, so I'm gonna make that motion, that we table the request for increase of fees until the January meeting, and you will email us each a new chart.
Yep.
And then we'll have all new questions for you.
Okay, yeah, I second that.
All those in favor?
Aye.
Aye, okay, great, thank you. Thank you, Rachel. We're gonna need you again
Thank
next
you. I'm sending
February
my
too.
email or phone if you guys have any further questions.
Will do, thank you.
Okay, good. Actually, you answered my question, look at last increase date.
Yeah. Yeah. Yeah, I mean, the cost of some of the inspections have gone up on the food program.
It's the wisest track to take to make all the city's fees equal, so if there's no competition, they're not going to Salem because it costs less to do business in Salem, or they're not going to
Yeah.
Lynn because it costs less, or they're not coming to Lynn because it costs more. I mean, that's good business.
Yes, exactly, agreed.
Okay, next on the agenda, old business?
I don't think we have any.
I don't have any old business. Only old
I guess
board members.
the Carusos, I'm assuming,
Oh, well, that was interesting. So they went out there the next day, and during their inspection, they found the illegal basement bedroom.
Oh, my goodness. Okay.
all right.
So he didn't open again.
Yeah,
He didn't get an A, he didn't
So
get an A.
needless to say, it did not pass, and I think we've already heard that he's out and someone new is looking to purchase the business. So I had suggested, one of the things that I had been doing was making sure people get a copy of the last inspection report. Like, just before it's one thing
So they know
if
what
you're
they're
just
jumping
not
into,
organized
yeah.
enough to have sanitizer test strips in the store, right? It's another thing that you buy a business and don't realize it needs another sink. So,
Let me ask you, I read the minutes of the meeting before I came, and it said something about he claimed that it was issues with the landlord in the building that was causing him to fail.
Right.
Was that really just a song and
So-
dance, or was that true?
oh, April, you're still here, good.
Oh.
I'm still on. So I did go to the inspection along with our other food inspector, and it was just one thing after another. You know, he was asked. There's no soap or paper towels next to the sink. He was asked where his food thermometer was. It was still in the package. It wasn't even ever taken out. Obviously shows that it doesn't work. None of the thermometers work. The walk-in freezer in the basement had been broken for some time. There was food stacked up in there, moldy. There was an illegal apartment in the basement that he had been living in that included bottles of urine everywhere. The list just went on and on and on, and I just looked at him, and he basically was like, yeah, I'm gonna close. I said, yeah, you are. The landlord has evicted him. He is out. The illegal apartment has been removed by the building owner, and there is someone to the effect of the previous Caruso's owner is going to try to reopen. So I did forward them the last inspection. I know a big thing was the way he changed the floor plan in the kitchen required a prep sink. He is aware that he needs to put the prep sink in and whatever else he needs to do, he's willing to do it, so.
All right.
Told her she's doing a great job.
Who owns it?
I don't know who owns the property, but April alluded that a previous business owner of Crusoe's is looking to get back into owning it. It's been a lot of, I mean, I've been around a long time, so I don't know, I know a lot of owners.
Great.
So the debate about whether or not he was in a contract illegally has nothing to do with us. We just know that food-wise, he wasn't following procedures and it was time for him to close anyways.
Okay.
Something we can talk about next month.
I missed all the excitement. Okay, anything else under old business? Anything else under new business?
No,
We get to go home?
I guess you can. Do we want to pick a next meeting date?
Yeah.
Sure.
So looks like this first Tuesday is the 7th. How is that for everybody? Seems a little
Yeah.
late, right, because of the way, because January starts on a Wednesday.
Yeah.
Yeah,
Works
that's
for me.
fine. Okay.
Wow,
That's good.
1/7/25.
Wow.
Phew. Time is flying.
Great. Before we, anything else? We got anything else on the?
April, are you still there? Oh, she got me on mute. I mentioned it earlier, just want to say, I know I
Yeah,
don't.
I'm here.
Ah, you're still here. I always give a lot of credit to these guys. April does a great job doing the work on the environmental health side for the Board of Health up in ISD. April, how long have you been in the role?
June would, not even, for the health department, it's all a blur. Since June of 2024 is when I came into this position.
Okay, yeah, so she's really doing a great job out there, and, you know, she's leveling things up. She's come up with some new, easier to read flyers for people to understand what we're doing and stuff like that, and I just wanted to give her some
Great.
kudos to that, because you guys don't get to really talk to her or interact with her that much, but she's out there doing a lot of the work on behalf of the board, so you're doing a great job, girl.
Keep up the good work.
Your help, Lisa.
Okay, before we do our favorite motion, I just want to wish everybody a happy holiday. Thank you all for your assistance and help throughout the year. Be safe, my fellow commissioners. Hopefully your shopping's almost all done. And I'm looking for a motion to adjourn.
I can second that motion to adjourn.
Okay, all those in favor?
Aye.
Aye.